Ophthalmology is the next section. So here again, as we discussed with psychiatry, special EM codes are also available for ophthalmologists and optometrists. So you should understand, so we call them as vision codes because EM codes are common across the entire specialties, right? Any doctor or any healthcare provider can report the EM codes like 99201, 2020, 203. Whereas certain specialists like we had for psychiatrists, they had their own code. Same way for ophthalmologists also have their own code. So we call them as vision codes. It can be used by optometrists and some payers might want only the eye codes. So we call them as the eye codes or the vision codes. When a patient has a vision plan, then you are supposed to send only these vision or the eye codes. If you report EM codes, that would be denied. So you will have to know the payer specific guideline. Again, an optometrist can report only a eye code. Okay. So here, imagine the various levels of codes that we had in the E&M, right? 201, 202, 3, 4, 5. So here again, what you can do is like same way as a follow-up patient, we had 211 to 215. In the same way, we have the same classification as a new patient and established patient, but there are only two levels as intermediate and comprehensive. Say a patient presenting with an acute problem that does not require an investigation into the cause of the disease, like the underlying cause, things like that. And secondly, you can see a patient with a cataract where the doctor will have to make a thorough understanding of the patient's pathophysiology. So this could be a case of a comprehensive care or a comprehensive level. So you will have to just understand from level 201 to 203 might be intermediate, 204 to 205 could be comprehensive. Please figure out if the patient is presenting for a minor ailment like an iritis or a conjunctivitis or for like chronic or time taking conditions like cataract. So accordingly you can assign the level of care as intermediate and comprehensive. Plus you should also know some of the basic tests that are already bundled with these levels of care. Say for example, when you are going to report a code for this comprehensive level of service, you can't report SLE, which is the slit lamp examination or a tonometry separately. So the CPT book tells you very clearly that you cannot itemization of services such as SLE keratometry and a routine ophthalmoscopy, retinoscopy, tonometry or motor evaluation is not applicable. Even if the provider has done these services, you can't report them separately.